The effect of therapy is mostly measured by degrees of change in spinal curvature or Cobb angle. This measure is regarded the best determination of the curve magnitude. Bracing versus no treatment. In one low-quality study, an underarm plastic brace was compared with no treatment, and the researchers found a significant reduced failure rate in favor of the brace group. Bracing as an add-on treatment. Concerning the effectiveness of a Milwaukee brace as an add-on treatment to exercises, one high-quality study showed no additional effect of bracing. In addition, the mean change of spinal curvature in all groups was small. Bracing versus exercises. One low-quality study evaluated the effectiveness of brace compared with side shift exercises and showed no difference. Bracing versus electrical stimulation. Two low-quality studies compared bracing and electrical stimulation. Natchinson and Peterson found in their low-quality study significant differences in favor of an underarm plastic brace of approximately 40 to 80%. Bracing in comparison of different types of bracing. 5 studies, all of low quality, evaluated the effectiveness of different braces. No data were provided for one study, and the small changes of the spinal curve were found in both treatment and control groups in another study. In 3 studies, no significant differences were found in favor of a certain brace. Exercise. One low-quality study evaluated the effectiveness of exercises between subjects who adhered and those who did not adhere to the exercise program, and showed a difference of 14 degrees in spinal curvature in favor of behaviorally posture-oriented exercises, but the study was exceptionally low power. Exercise as an add-on treatment. 2 studies evaluated exercise as an add-on treatment to wearing a brace. One high-quality study showed no additional effect of exercises on the spinal curves. In another low-quality study, no difference in surgery rates were found, and only small changes in spinal curvatures were found in both treatment and control groups. Exercise versus other interventions. One low-quality study was found that evaluated exercises versus traction during the night. Only small changes in spinal curvature were found in both groups. Electrical stimulation versus no treatment. When electrical stimulation was compared with no treatment in one low-quality study, no difference in effect was found. Failure rates were high in both treatment and control groups. Electrical stimulation as an add-on treatment. When electrical stimulation was evaluated as an add-on treatment to exercise therapy in one high-quality study, no difference in effect was found. Only small changes of the spinal curve were found in both treatment and control groups. There is limited evidence of the effectiveness of bracing when compared with no treatment. In addition, limited evidence was found for the effectiveness of bracing and reducing the spinal curve when compared with electrical stimulation. Sensitivity analysis. When using the first criterion of high quality, no studies were considered to be of high quality. The conclusion concerning the effectiveness of different braces would not change. Overall, no statistical differences between the groups could be found, but a large percentage of patients with a decrease of scoliotic curve were found while wearing a brace when compared with other interventions. The only study that shows the statistically significant differences was a study by Natchinson and Peterson, but this study was of low quality and non-randomized. In the study, bracing was found to be superior when compared with no treatment or electrical stimulation. In addition, no differences among different braces or between braces and exercises could be found. Therefore, they conclude that the effectiveness of bracing and exercise is not yet established. This systematic review might have some limitations. Most studies were low quality, low power, and so using different criteria cutoff points for quality, though, their conclusions did not change. Most articles did not mention follow-up period. Most studies didn't address the measurement of the treatment adherence. The risk of publication and language bias in the review is probably small because they performed an extensive search and no study was found that could be included because of language. Some rather well-known studies were excluded because of the design. Most designs were retrospective and did not have a control group, although this was not all clearly stated, such as in study by Noonan and Ferdinand. Further research should focus on large, high-quality randomized control studies. They believe that it is possible and necessary to conduct a randomized trial evaluating braces and exercises, including an untreated control group with a follow-up until adulthood. We believe that in the future research, outcome measures should include psychological and social effects of different conservative treatments for adolescent idiopathic scoliosis. Conclusion. The power and quality of studies were low and the studies were varied. Therefore, it was impossible to draw firm conclusions regarding the effectiveness of conservative treatments for adolescents with idiopathic scoliosis. They conclude that the effectiveness of bracing and exercise is promising but not yet established. They believe that everything is inconclusive, but I don't believe that the brace isn't effective. From personal experience, I believe that the brace helps to alleviate the spinal curvature. It proves to have a significant decrease. Further experiments could explore surgery versus the use of bracing. Thank you.